So good afternoon, everybody. Thank you for joining us for this webinar, Health in Action, Applying a Social Determinant of Health Lens to Traditional Community Development. My name is Lisa Much. I'm the Communications and Capacity Building Director at Ohio CDC Association. Super excited to welcome you all today to this interactive session, which is being recorded. Everybody who registered will receive a copy by, I'd like to think, the end of tomorrow, week's end, but realistically it might be early next week. And it'll also be posted to the website, our training and technical assistance page as well, so you'll have access to it. And then I believe everyone is muted right now, and I just ask that when you're not speaking, if you can mute yourself to eliminate the background noise. If you have a question during the session, please type it in the questions, the chat box, either to me or the group, and we'll get to it at the end of the session. We have so much to talk about today. There's like a ton of stuff we're doing, and I'm super excited for it. So I would just love to jump right in and pass it over to Amber Jones and Hope Fierro of Old Brooklyn CDC in Cleveland to lead this session. So Amber?
All right, thank you so much, Lisa. I'm really excited to be here. I'm joined by my colleague Hope. We represent Old Brooklyn Community Development Corporation up in Cleveland. And as we go through the day, as Lisa said, feel free to drop any questions in the chat and we'll get to them toward the end. So we ask that you hold all questions until then. And towards the end of the presentation, we actually have an interactive portion. So it'll be really exciting and really applying this lens to your own work. So Hope, do you want to just go ahead and do a quick intro and we'll get started?
Hi everyone, I'm Hope Fierro. I am the Community Health Coordinator at Old Brooklyn CDC, and I am excited to be here. So let's get started.
All right, so as Lisa said, we are applying a social determinants of health lens to traditional community development work. And so we really see this work as, you know, a very interconnected part of our health and our daily lives. And, you know, our community's health, our health is very complex. And the social determinants of health really help us as an organization understand where we can interact and where we can intervene in our own work in community development. And there are just so many solutions that we can layer on and layer together as we move through our work. So Hope, can you go to the next slide? All right, so to give you guys a little bit of reference of the Old Brooklyn neighborhood in Old Brooklyn CDC, we are located just south of Cleveland City Center. We're about 10 minutes away from downtown by car. And as you can see in the enlarged map, this is our neighborhood. It is the largest one in Cleveland at about 35,000 people and about 6 square miles. So we are bordered on the north by Cleveland Metro Park Zoo, right there kind of in the middle of your screen. On the east side by the Freeway 176 and go a little over it. On the south side is 480. And then on the west side of the neighborhood is Ridge Road, where we intersect and overlap a little bit there. So we do have quite a large area that we're looking at, and our office is actually right in the heart, right almost exactly where the Old Brooklyn letters are on your map. And so we are right in the heart of Old Brooklyn and thinking about all of our residents and addressing their needs. So a little bit about our community. We are one of the fastest growing Latinx communities in the county, as well as the fastest growing Black and African American community in the city of Cleveland. And so our neighborhood is very diverse and it's becoming more diverse every year. And in addition to that demographic, we also have a large and growing population of youth under the age of 18 we have about 11 schools in our neighborhood alone. And so we try and focus a lot of our work on the neighborhood's youth, because they are the voices that we need to be hearing from that are typically not part of the conversation. And then on the flip side of that, we also have a very large senior population. As our neighborhood ages in place, a lot of those folks are looking to continue living in their homes, but maybe don't have the access or the resources that they need to continue living in maybe a larger space than they need. And so how can we continue to support all members of our community throughout their life cycle within Old Brooklyn? And so as we were thinking about how do we best serve our community, we began this process of doing a strategic refresh or a strategic planning process in 2015, where we identified community health as part of a new way of looking at our work, and including that in every aspect of our work. So our mission is to grow Old Brooklyn through empowered partnerships, leadership, programming, and advocacy. And through that mission, we were looking at our organization through 4 main pillars, which are on your screen. So fostering a healthy community, putting Old Brooklyn on the map, letting people know where we are, leading smart neighborhood development. And so when we're thinking about neighborhood development, that's very focused on community development. That's where we spend a lot of our time in our work. And then the last pillar was around a strong, responsive community backbone, being able to adapt quickly, lead, and grow our neighborhood by being responsive to the needs of our community. And so through this process, we found that community health, we weren't taking into account as much of the needs of the people who are living there. So we were focusing on place without always thinking about the impact on a person's health. And by health, I mean, thank you, Hope. I mean, thinking beyond healthcare and clinical care. So as you can see on this slide on the bottom part, this graphic is one of my favorites, because when you're looking at healthcare, it's only 20% of a person's health. So you're thinking about that, right? So when you're thinking about health, people typically think of, oh, I have diabetes, or I have hypertension, I have a broken leg and I need help. I've gotten sick and I can't, I need some medicine. But the other 80% is everything beyond clinical care. It is our socioeconomic factors of education, our income, our jobs. It is also our health behaviors. So that's about 30%. And that is, if we smoke, how our diet is, what types of food we're eating. Do we have access to exercise, and are we actually doing it? And so thinking about those aspects of our health, there's also the physical environment. And I know that's where we in community development spend a lot of our time, thinking about the place in which we live. So that could be our housing, that could be the small businesses, that could be our access to mobility and walkability of our neighborhoods. And that's really the physical environment. So when we're thinking about health, we need to think beyond the traditional sense of health, because when you get past that portion, you begin to understand that community development is community health. And I just want to take a minute to pull out this really great quote from Healthy People 2020, which is what we had based a lot of our work on. So currently, Healthy People 2030 is the one that is being used, and it's constantly updated every 10 years. So when we started this work, we were utilizing Healthy People 2020. But I do think that this quote and definition really highlights exactly the frame that we're using. So every person deserves an equal opportunity to make the choices that lead to good health. But to ensure that all people have that opportunity, advances are needed not only in healthcare, but also fields such as education, childcare, housing, business, law, media, community planning, transportation, and agriculture. But I would even say that list expands beyond that. As we think about health, it's the systems and the environment that we live in that impacts our ability to be healthy. So when I think of health and I think of, a whole person's lived experience, there's upstream and downstream effects. So when we're looking at downstream is over on the right-hand side. It is our ability it's our life expectancy, it's our mortality, it's our ability to stay healthy. So thinking about disease and injury, those are downstream. That means that when we're talking, like, these are things that are happening to us because of the systems that we are living in. Our risk behaviors, that's, smoking, alcohol use, poor nutrition, your eating habits. Those are things that, if you had better education or access to healthy foods, maybe you would make different choices. And so when we're thinking about our work in community development and community health, we're looking at the upstream effects. And that is really where we're moving along this continuum to address the root causes of these challenges or these health problems that are happening later on in life or later on, but we are actually able to address them as a primary prevention technique. So looking at the middle of your screen, living conditions, I'm going to read a few of them off to you, and I'm sure as I read them, you'll see like, oh yes, we do this in community development. Oh yes, I do this. So when we're thinking about our living conditions, that's our physical environment. That is land use. That is transportation. So bus lines, being able to walk, your mobility. We're talking about housing. So do you have safe, affordable homes? We are looking at the economic and work environment. So opportunities for employment. That's looking at how much a person makes so that they're able to live in a safe, affordable home and provide the necessary needs for their families. That's looking at retail businesses and small businesses. So are they available in your communities? Do they have the supports that they need to be successful? And then that's also looking at the social and service environments of our communities. So thinking about our culture, maybe even violence and crime, and also thinking about education and our social services that we have here. And so thinking about our living conditions, that's really where we spend a lot of our time in community development, thinking about capacity building, community organizing. I'm sure some of you have those roles on your staff right now. And so that's where we do a lot of this work in thinking about connecting to the community and what those conditions are to make improvements. And moving even further upstream to the institutional and social inequities, we spend a lot of time in that space as well, about strategic partnerships, advocating on behalf of the residents that we serve, and thinking about how we can make changes to the systemic level and advocate for policies that address some of those challenges. And so as part of our process, we were building and moving through how do we do this in our work at Old Brooklyn CDC, knowing all of this stuff, knowing about the social determinants of health, knowing that we work in these areas, what can we do and what does this mean when we're thinking about community health? And so we started on this path to understand the needs in our community. If you want to go to the next slide, Hope. We conducted a community health needs assessment to understand the real needs and the root causes in our community. A health needs assessment is typically done by hospital systems or regional boards of health, where they look at a large area of population. They're looking at, the Cuyahoga County and like 2 or 3 other counties all coming together for this data. So it's pretty high level, even if they do dig into, Cleveland as a whole or neighboring communities like Lakewood, Parma, outside of the city itself. But what we wanted to do was utilize this public health framework, as known as a community health needs assessment, to understand the needs of our community at a very granular level. And so that by doing this assessment, we were able to understand what exactly was going on in our communities. So we created the health needs assessment in partnership with many folks throughout the Cleveland area based on the social determinants of health. And Hope will go into a lot of information later on what the social determinants of health are and how we apply that to our work. But it was the basis of the creation for our health needs assessment. And from our assessment, we had 6 focus areas. But what was really important for us was understanding that this work leads into 2 underlying factors that impact our work at a systemic level. And without taking into consideration and striving to address structural racism and economic opportunity as root causes that impact our 6 focus areas, we would not be doing justice to the people who are living in our neighborhoods. And so, we know that structural racism has a profoundly negative impact on communities of color because it's so deeply embedded in our society and in everything that we do. It is in the places that we work, and play and worship. It creates inequities in housing and education. And so as we were thinking about our work, we knew that we had to incorporate economic opportunity and structural racism as a lens as to how we are able to address those systemic challenges within our 6 focus areas. And so as I share our 6 focus areas, keep that in mind that we would not be able to do this work without addressing both of these underlying factors. Next slide, please. So from our health needs assessment, we had 6 focus areas. The 4 that you see on the left side of your screen are blue. And those are the focus areas that as community development and in our work itself, that we have a direct focus in. We have worked within food access, green space, when we're thinking about land use, in our parks, housing, really thinking through how we can provide additional housing in our community for members who are looking to move into Old Brooklyn, but also thinking about how we can repair and rehab homes and housing units that are already within Old Brooklyn. And then resource access and usage is really that focus on how do we connect the residents to the things that they need within our community. The 2 focus areas on the right side, the 2 gray ones, is where we really rely on partnerships. Partnerships have become, and I'm sure across all of our work, really matters when we do this work. So chronic disease and substance use are 2 areas where we rely on some of our clinical partnerships to really understand the needs and how to address some of those really distinct challenges around chronic disease. So hypertension, diabetes, obesity. were our top 3 chronic diseases when we did our health needs assessment. And so how can we as an organization think about food access in terms of chronic disease and obesity? Pulling out some of those pieces where we're then able to address food access and in the long run, be able to address some of the chronic diseases that are prevalent in our communities. And so that's where we rely a lot on our partnerships in some of those clinical care settings to work together towards a solution that is more upstream rather than just treating the disease itself. And so based on this work, we have had, by reframing our work to incorporate the social determinants of health and the community health lens, this opened up our ability to be more effective and more impactful in our communities by layering in different approaches that might not have been visible or just that we didn't know about previously. And so I'm sure you guys have a lot of questions so far. So I'm actually going to turn this over to Hope so that she can share a little bit more about how we have done this in our own work, applying this lens and reframing some of the different aspects within our 6 focus areas. So we have 3 examples that she's going to share. That way it can get you thinking before we turn this into an interactive session. So Hope, it's on to you.
Thanks, Amber. So now that Amber has explained all of our 6 focus areas, we are going to focus on 3 today. So those are food insecurity, housing injustice, and Greenspace equity. So before we get into that, though, I did want to point out that throughout the presentation, we'll be referencing the 5 social determinants of health that were published by Healthy People 2030. And I know Amber mentioned Healthy People 2020 previously, but if you don't know what that is, it's the nation's 10-year plan for addressing our most important public health priorities and challenges in the US. And this is actually what we, like she said, designed our CHNA, what we based that on were these categories. So in this next slide, you can see some examples of what these categories actually mean. So a lot of your work, if you work at a CDC, probably goes into neighborhood and built environment, which includes things like affordable and safe housing, transportation, neighborhood development, and small businesses. And then you also have education access and quality, which include things like accessible youth programming and job opportunities. You have economic stability, which are things like economic policy, small business support, food security, employment programs, social and community contexts, which are things like civic participation, which is like voting in an election, access to gathering places like rec centers or places of worship, really anywhere where you can gather together with your community. And we also have healthcare access and quality. So it's what it sounds like. It's just easy access to high quality, affordable behavioral, physical, and mental health care. And now we'll go into some of our, some examples of how we've reframed our work to fit a social determinants of health lens. So I think the most prime example that we can give is our Old Brooklyn Farmers Market. So this is some annual event that we reframe to meet the needs of the community more intentionally. And with a farmer's market, usually, you might be thinking you go there to buy fruits and vegetables, maybe see a neighbor or two, enjoy the nice weather, like all these people in this picture, the nice summer weather. But we wanted to take this a step further and be more intentional about it. So we created 3 main goals for our summer farmers market. So those include increasing access to healthy food choices, transportation options, building community, and improving individual health perception and neighborhood perception. And in order to achieve these goals, we had to reframe our work. And one of the biggest changes that we made was the change in location. So you can see on this slide, there are a lot of examples of how we've reframed it. But in the first box, you can see more information about how we changed location and why. So when we had our market a couple years ago, before we reframed it, we had it at one of our local parks. It has a lot of green space, a lot of space for vendors and activities. It's in a residential area, but it's not really central to the neighborhood. And it wasn't easily seen. And if you were to just stop by, you might think it's a nice market. But if you take a step back, you can see that it's not as accessible to everyone in the neighborhood as it could be. So we decided to change the location to a more central place, which is on our main street. It's also located on a bus line now, so that way people without transportation can take a bus to our market. It's more centrally located for people to walk and bike. And we also included something called the Diamond Line. So Amber was talking previously about the importance of partnerships. And this is one of those examples that we really relied on our partners to make this a more accessible event. So we actually partnered with one of our senior resource centers who provides rides to their seniors to grocery stores and other things that they need to, other errands they need to run. But we partnered with them to use their buses and pay their drivers to actually take people to the farmers market. So they actually had stops throughout the neighborhood, and they would stop at our market, other local businesses, other grocery stores that were maybe a little far for some people to get to. And we actually gave the riders of the Diamond Line coins that they could actually use at the market. So this was just another way that we were able to use our partnerships and work with community partners to make this event more accessible to residents. And we also added more health and social activities. One of my favorite things that we did at the farmers market were cooking demonstrations. So this was a way that we could educate residents who may not know what to do with the vegetables they just bought at the market, to show them how they can make them more impactful. So I know for me, I don't even know how to use every vegetable in the grocery store. So these cooking demonstrations provided a way for people to learn and maybe learn from each other too, and to meet people and to make sure that they actually are using the things that they purchase from the market in a way that positively impacts their health. And we also made it a priority to hire vendors of color. So we wanted to make sure that the people representing our market represented the neighborhood as well. And we wanted residents to feel more comfortable coming to the market. And we also wanted to support business owners of color. We wanted to make sure that we provided an opportunity for them to promote their business to a wide audience, because the Old Brooklyn Farmers Market not only brings in Old Brooklyn residents, but people from around Cleveland as well. And we wanted to make sure that we provided an opportunity for them to continue to build their business in Old Brooklyn. And as you can see by this chart, it really did make an impact on people's health perception. So you can see that over the course of 15 weeks, each bar represents about 5 weeks. You can see that improvement in health perception. So I really do think that this is in part because of the changes that we made to make the market more accessible and bring more activities to the market. And I think it provided an opportunity for everyone to participate in healthy living and to eliminate barriers that they may have had to it before. So I think this is a really cool thing that we do. You should check it out this summer. But I think that's a great example of how we've reframed our work to fit the social determinants of health lens. And now that I've talked about the market, we also do work in healthy housing and housing injustice. And this is something that probably a lot of you who work in the CDC realm do in your daily work. But we wanted to show you what we've been up to and how we've reframed this work with that lens. So in 2020, Old Brooklyn CDC and other community partners, we came together to form something called the Healthy Housing Collaboration. So this allowed for us and our community partners to work more effectively together. A lot of us are doing work within the community that might overlap. And so it's important for us to communicate so we can make more of an impact and be more effective. So in our work within the collaboration, we created a shared definition of healthy housing. And this allowed us to work towards a common goal. And it's always good in a collaboration to have a common understanding of what you're actually working towards. So we created this definition, which you can see on the slide. So for us, healthy housing is housing that allows residents to live in a way that they want to, that fits their needs, and is affordable and safe, and encourages physical and mental health and overall well-being. And this is what guided our work in the collaboration. And one of the things that came out of that, and that we do at Old Brooklyn CDC, are home rehabs. So we actually have a healthy housing specialist that works with us, and they go from home to home to check on the exterior of the house. So they check for, caving in porches, chipped paint, broken windows, really anything on the exterior of the home that needs assistance or fixing. So when our healthy home specialist goes out and checks out the homes, she could just give a notice to these residents and say, you need to fix your porch and you need to fix it by this date. But we know that when there are exterior issues on a home, there may be issues inside the home as well. And we know that, especially with our home rehabs, they focus on seniors. So seniors may not have the physical ability to fix their home. Maybe they have declining health or economic instability or even food insecurity. So there are a lot of things that could be going on within the home that we want to make sure we address. So when we do check on the homes, and let's say they have something wrong with the outside, we make sure to talk with the resident and really get to know them and get to know what they need, so that way we can connect them to local resources and supports that can improve their quality of life. And as you've probably guessed, home rehabs go deeper than just the outside of the home. So you can see that along with home rehabs creating safe housing for the residents who live in them, they're also cost-free. So that relieves some economic burden off of that resident, so they can maybe purchase other things like food or medicine. And also, another aspect I wanted to touch on with this is that home rehabs are done a lot of times by volunteer groups, specifically Old Brooklyn residents that come together to work on these homes. So that allows for more social connectivity and just a sense of neighborhood pride. You know, when you come together and work on something, and something especially like a home rehab, you can actually see the before and after and just see all the work that you put in as a group. And I think that that brings people together, and also for the resident who they were supporting, I think that that also gives them a sense of belonging, that someone, especially specifically their neighbors, were willing to come together and help them. And that really does improve your overall well-being, to know that you belong in the community and that you're cared for. So yeah, home rehabs are a lot more than just fixing the outside of a home. And the last focus area that we wanted to discuss today was Greenspace Equity. So as you can see on the slide, we do a lot within this area, and you know, with focus groups and reforestation programs and building new parks, there's a lot that we do with residents and other community partners to create a more equitable neighborhood when it comes to green space and access. And in order to do this, we do need partnerships. So I know that we've been talking about partnerships a lot, but they are so, so important in this work. And, you know, that could be with community organizations, other CDCs, local government, like the city or the county. All of these things, all of these people come together to make these things happen. And I realized I forgot to mention residents. Residents are a very important part in our work because all of the work that we do affects them. And we want to make sure that they're included in these planning processes and focus groups. And we need their input and their expertise to do the work that we do, because they're the ones who actually have been living here and experiencing daily life in Old Brooklyn. So we need to make sure that we include them every step of the way. And, you know, planting trees and creating more green space does create a more aesthetic neighborhood and makes everything look better. But of course, it goes deeper than that. So with these 5 categories of social determinants of health, you can see that tree canopy, for example, affects a lot more than just the way the street looks. It allows for easier pedestrian travel, especially in the heat. I don't know if any of you have tried to walk down a sidewalk when it's really hot outside with no trees along it, but it gets really, really tough really fast. So if you're walking to school or walking to the bus stop or even waiting for the bus, you need trees to shade the area and make it easier to do that. Also, you know, close proximity to green space decreases stress, and that's something we all could use. And it also affects the economy, the local economy. When a business is close to a green space, it increases like local shopping and dining. So it invests in local economy. And also it allows for more social connectivity. So when you're close to a park, you know, you can go and have a picnic, you could have meetings there, play a sport there, take your kids there. There's a lot of opportunity to get to know your neighbors when you're close to a green space. So as you can see, green space is really much more than just the way things look. It really does impact your overall well-being as well, which is why it's so important to make sure that we have accessible, equitable green space in our neighborhood. And now that I've explained how we use the social determinants of health lens on our work, we want you to reframe it to your work. So Amber will guide us through a worksheet and activity where you can actually see this in action. So I will pass it over to Amber.
Yeah, all right. So I'm sure you guys have been thinking, as Hope went through, how you guys can layer your own work into this lens, pulling the connections and kind of just thinking through like, oh, I have this project that like I could see this working for. So as we move into the next slide, thinking about how we did this work and how you could potentially do it in your own work. I do want to note that, you know, we conducted a health needs assessment, and that was to help us understand what are the priorities at this point in time right now. And so, you know, from that community health needs assessment, it was that guidebook for us. It helped us understand that food access and green space equity and the 4 other focus areas were where we wanted to start and what we wanted to prioritize. But you know, you can use a social determinants of health lens at any point in your work. It's just a reframing of, you know, your traditional way of doing things. So thinking about the questions in which you ask yourself to make your work more equitable and just more, you know, the ability to connect with residents and understand their needs, and then layer in those approaches together. So as Hope mentioned, it's not just about tree canopy and increasing tree canopy. It's about all of these other factors that maybe don't get thought about in the work that you're doing. And so that's why a social determinants of health lens is just so impactful, because then you're able to come at it from a different direction than you may have thought about it originally. And so we're going to open this up to you guys. We're going to get a little interactive at the right now and then open it up to a worksheet after this. But we are going to utilize Menti, which is a polling platform. So either you can take your phone, hold it up to the QR code, take a picture of it, and it'll show up as a link that you can click and it'll take you to a question. Or there will be a link in the chat that we can share. Okay, chat already.
Yeah.
So go ahead and click on that. Our first question is, in which areas of your work can you apply a social determinants of health lens? Feel free to share as many as you want. It doesn't have to be just one. As answers come in, I'll read them off. But as some examples that Hope mentioned, we did it with our farmers market. We've thought about it with our summer camp. All right, we have workforce, Greenspace, and beautification projects. I love that. Definitely with workforce, we have a program called the Ambassador Program in our own office that we have thought about how we connect community ambassadors with small businesses and actually beautification projects within the community. Oh yeah, farmers market, healthy eating. Someone says we already do this. I love that. What are some places in which you do it? Go ahead and share them. You know, there's green spaces, so that could be parks, but that could also be your main streets, thinking about, you know, the walkability on your main corridors. Is it easy to get around? Okay, I see some home rehabs, of course. Yes, I love that. Financial empowerment, of course. Some financial literacy and understanding how to share, you know, how to understand your finances, what that looks like and what that means. What else are people doing? I'm interested to see, yeah. Oh, neighborhood legal clinics. And education on those topics. I love that. Yeah, education is a really important factor. You know, Hope mentioned it with our farmers market, thinking about education not only around the types of food that are available at markets and how to cook them. A lot of people are like, I don't know what to do with eggplant. I am one of those people. So like having a cooking demonstration was so helpful because it provided not only education on the food, on how to prepare the food in an easy and accessible way. And additionally, at our farmers market, we thought about education around SNAP and WIC, which is a really big key part of our work at the market. Is how do we make it more accessible to more people? I love that. Education is a really important piece. All right. I saw another one pop up. Physical access to affordable food year round. Language, what is that? Plan language. Oh, year-round plan. There we go. I can read. Language, business development, and business development training. Those are all really great, especially the entrepreneur incubation, like really providing the resources and assistance to small businesses in our communities. One of the things that we started doing was hosting basically a small business series to help support and uplift the small businesses and the entrepreneurs who are already in our neighborhood to be able to share their expertise across the community and really providing the resources that, you know, they don't have access to or don't have the time to actually commit to, and being able to provide that for them. And using a social determinants of health lens, we're able to do that in a way where we're not only thinking about small business, but we're thinking about the social media aspect of their work or the tech parts of our work. All right, so we have plain language business development. I would love to hear more about what that means. If anyone wants to put that into the chat, I'm not as familiar with that. Oh yeah, plain language and everything you're doing. Also accessibility and cultural competency. Yeah, so making something that's easily understood and accessible. And by accessibility, there's a lot of different avenues accessibility can take. That could be mobility and accessibility, like being able to get places. It can also be accessibility as in like when we're thinking about disabilities, like, are we making the work that we're doing accessible to everyone in our communities? And I think that's a really important piece as well. All right, I think I'm going to jump on over to our second question. And I think this one is a little bit more in depth for us. So when we are thinking about utilizing a social determinants of health lens, what types of questions should we be asking ourselves in some of these programs? So as an example, where is this program located? Is it accessible? I know that was one of the things that came up in the last one. What are the questions that you guys can ask yourselves about your programs to see if you're reaching the right audience, or thinking about, the work that you do? How can we reframe some of our programs?
And then on your phone or on your computer, there might be a little notification that popped up that said that I switched slides. So just make sure to go to that next question.
Oh yeah, great catch, Hope. Yeah, so what are the questions that, when you're thinking about your programs and how to make them more equitable? Oh yeah, I love this. What do residents need? That is the number one question, right? That's what led us on this journey of community health and the community health needs assessment. What are their actual needs? Let's see. The next question up there is, if I wasn't proficient in this practice or topic, would I be able to feel like it's accessible to me? That is a fabulous question. So if you're thinking about, let's talk about financial literacy. If I didn't know what to do with my retirement, like, what does that mean for other people? And would I be able to understand this? All right, let's see. The red box says, who is this really helping? Oh, I love that. Goes back to that question of audience. What are our goals around this project, program, work that we're doing? And is it actually helping them? Are we reaching the right people? Let's see, gold box. Which residents are accessing resources and who is being left out? That is a really big one. Sometimes it's not looking at who are we reaching, but who are we not reaching? And I know that's a big question in our work, and thinking about different programming and how we're connecting. I think that's another great question. Are the ways in which we are doing outreach effective? Are they reaching the people that we want to reach? I love these questions that are coming in. Feel free to continue answering the question on Menti, but we are going to move into our worksheets. So I know it's been about an hour since we started, so this is perfect timing. So our worksheet is going to kind of go through this practice with all of you. So if anyone would like to share a program or a focus area that you think would be really great to kind of go through, or you're really interested in how we can utilize this framework in your own work, we would love to choose a focus area of your choice. You can feel free to drop it in the chat box, or we can even pick one from the Menti list from our first question. If no one wants to drop it in the chat right now, I'll give you guys like 2 minutes. I'll give you guys a minute, 30 seconds to throw something in there if you'd like to. Otherwise, we're going to choose for you. Food retail. All right, that's it. You're our winner, Thomas. I love it. All right. So, Thomas, would you mind if I brought you off mute so you can share a little bit more about your food retail program, and then we'll go through this as a group? All right, thanks.
All right, what do you want to know?
Yeah, just tell me a little bit about what you have going on right now.
So we've been operating a mobile grocery market, which is basically a grocery store on wheels for this will be our 9th season of doing that. And the end of 2020, we opened a neighborhood style grocery store right in the middle of a food apartheid, 2.5 blocks from the main bus terminal here in Canton, Ohio. And we're in talks to open up several more of those neighborhood style stores over the next few years here.
Oh, that's wonderful. I love that. It sounds amazing. So, right. So as we kind of go through this worksheet, I would love for anyone to jump in, but feel free to drop any notes in the chat. So our focus area is a mobile grocery market and then some neighborhood markets. So, or neighborhood groceries. So what I heard just right now, you felt that, you know, hearing from the neighborhood that there was a food apartheid location within the neighborhood. And so you recognized that that was a space for you guys to intervene. And so question number 2 is, what is your organization currently doing in this space? And Thomas, don't feel the need to come off mute. We're gonna walk through this all together. So what are you currently doing in this space? So you said that you started with a mobile grocery and you recognized that it was within an area known as a food apartheid. So that's an area without healthy food options. And so thinking about what is currently being done. There was no grocery store, obviously. There was no options for healthy food. And, you know, thinking about where in the neighborhood is a good piece of that. And so for question number 2, it's a really good opportunity for looking a little deeper into what are your current, like, where are you currently operating? So thinking about our farmers market, we had a farmers market, right? Like that was thing number 1. And so when we're thinking about this, you had a mobile grocery market, but you knew you needed to do more. And so I think that is a really good position to kind of move forward. Thomas, you want to add something else?
Yeah, so that's how we ended up with the mobile, is we used to run a stationary farmers market and realized that you could only reach a small number of people that way. And so if we targeted the areas that needed it the most, we'd be able to reach, even if it was the same amount of people, would be able to do it and reach the people who needed it most. So a lot of times people who are coming to farmers market have the mobility to do that. So the target for the mobile was places that people have either physical or placement mobility challenges, and places that were low income, so our target population. And then from that, and operating that for many years, we realized that what people need is a year-round store that they can go to in their neighborhood, where people who have some mobility, where they could go, you know, a block or half a block. We needed a brick and mortar solution.
Yeah.
So it's progressions.
Yeah, totally. It's always a stepping stone. One of the things that we didn't mention, because it didn't quite fit into our presentation, but we utilize a short, mid, and long-term strategy in our work. So thinking about what are the needs right now in that short term, and that's, you know, that was with our farmers market. People needed accessible, healthy foods, and so that was like the short term. And so then thinking about midterm, what are the conditions or structures in the neighborhood that make a farmer's market maybe not, I wouldn't say not sustainable, but growing that into something that really thinks through those conditions of the neighborhood. And I really like that you mentioned that, Thomas, of knowing exactly where in your communities that you're like, these are spaces and these are the places that make sense for having and for expanding upon a farmer's market, as you said, into a mobile grocery, into a more permanent bricks and mortar store, thinking more about the long-term impacts of that work and of that grocery.
Yeah, and the places that we're looking at for increased brick and mortar stores are around the corner or very much in the exact same areas that we're currently going with our mobile, and just interacting with other partners to make that happen.
Awesome. That makes me like move right into question number 3 here. You know, what are the questions that we can ask of our focus areas to make it more equitable? And, you know, you hit on a lot of those things of where are we, where are the people, like who are the folks that need healthy food, and is it accessible to them? And this goes back to that mentee question number 2 of like, what are those questions that we need to be asking ourselves to reframe this work? And, you know, as you mentioned, you know, you targeted areas that were considered food apartheid spaces because you knew that there was a need in those spaces. And, you know, what are some of those other questions that we can ask ourselves as we kind of build out food retail? Who is our audience? You know, how are people getting there? I think that's another big one. Like, is it accessible to people nearby or people coming from far away? I think another question that typically comes up is, you know, thinking about the farmers market, that first iteration. You know, do people need more than the hours, like extending your hours beyond what's available through a farmers market? Are other good questions to be asking. And then one of the big things that I think always comes up is, how are we connecting with the population or with your residents and with your business owners in that space too? So is your outreach in a language that makes up your community? Does it speak to what they are looking for? And so thinking about also how you do your outreach. Are you doing door knocking? Are you doing social media or just an online presence only? Because it might be different depending on the place that you are, the people that you're trying to connect with, and the program that you're doing. Some might lend itself to a more digital space than you know, in person. And even now with COVID, thinking about how we connect with people, that has shifted quite a bit. And so thinking about those questions as well. All right, so I'm going to jump down to question number 4. What are 3 things that you could do to make this focus area more equitable? And Tom, I think you've done a phenomenal job so far. I'm just gonna put that out there for you. Thinking through how you can continue to make updates and make changes and kind of move through this space. So thinking about, you know, your future plans, you know, thinking about more or additional locations for these small grocers within those communities that need them the most. And I think that's probably one of the biggest things that you could do to continue connecting, and beyond just food retail, but how can we layer in other aspects beyond just food? So thinking about small business development, is there a way to help support the grocers and the people who are working there? Are there programs that we could connect them to, continuing education that might help them in the long term on their career paths and their professional paths? And then thinking about the people who are coming into the store to shop as well. What are some other areas of their lives that maybe we should look beyond food? Are there other areas that, you know, they need assistance with, that this could then, you know, play a role in their lives? So I think there's definitely some areas where you could continue expanding. I saw you wanted to say something, Thomas, go ahead.
Yeah, I don't want to monopolize this.
No, this is great.
Yeah, so we identified that there's definitely a large gap in our community, in our county with regards to actual systemic work around food. There are some individuals and some groups doing different things, creative things in housing and in healthcare and mental health. And so our strategy is focus solely on the food and be the best at that. And so we become the go-to partner for all things food. And we engage with many different organizations who are doing, they could be overlapping each other, but they're the experts in those areas. So instead of us taking housing and dealing with those other determinants, we access food. And in that, so in our food justice campus, we have a food incubation center, and that's where we do, we have the only shared kitchen space in the county. We have business development classes. That's where, like you said, what else can we do? We realize that a lot of the people who are coming to use the kitchen are these individuals from the areas that we're already serving, saying, hey, I do really good cornbread, so I think I'm going to make that a business. I'm going to name it Tom's Cornbread, and that's all I need to start this business. And we realized that no, there needs to be a business development and some sort of training and food safety training, all that stuff. And so that's why we developed the plain language business class, is because most of the offerings that are being offered, you need a business degree just to understand what's going on, and it was completely inaccessible. And so it's taken us a couple of years to refine it to get it down. But now you have people coming through that class with hope and not being overwhelmed, and some guidance along the way to help, their food-based businesses, but then they can sell in our retail environments or utilize our resources here at the campus to reduce or remove a barrier for them to be able to earn some money.
Yeah, no, I absolutely love that. And I think you're really on that right track of, do something really well, and then how can you expand within that space where it might touch those other aspects in some way. So like, yeah, going into housing doesn't make sense for you, but providing business support and plain language classes and business development is something that you wouldn't necessarily automatically think of when you're thinking about food retail. And so really bridging that gap and layering in those different possibilities are really important. And I heard you touch on like the partnerships, which is question number 5. Who are some potential partners that you can work with in this work? And so thinking about how we can utilize those partnerships. So there are people doing similar work, and how can we leverage them together? But also thinking about who are some of those new partners that might be part of this work as well. And I think that's a really, really helpful and necessary step when we're thinking about how do we apply this lens, because it opens up new avenues of thought and new avenues for growth and development in whatever area that we're doing. And so just to kind of wrap up some of this, because I want to save some time for questions from everyone. What are the next steps? Question number 6, how can you make this focus area more equitable? What are you going to do? And so this is the part where, taking a couple of these questions, thinking about those partnerships, you would want to, connect with those partners, plan out some programming. For us, it was moving our market. For Thomas, it was creating a brick and mortar storefront and grocery. And so thinking about what are those next steps that will help get you to that space where you're reaching the audience you want to reach. You have a program that's accessible in multiple ways, and is really reaching the audience that you're looking for. And so I'm going to have us scroll down just a little bit. You guys will all be getting this worksheet after the webinar today. That way you're able to use it for your own work. On the back of that first page is a table that shows you the social determinants of health and what might that impact look like for your work. And I will say in almost every scenario, no matter what focus area it is, you should have something in each of the impact boxes. There is some way that it connects your work, even if you don't quite think about it right off the top of your head. And I do believe that taking some time to really dive in and dig a little deeper into the social determinants of health and the 5 buckets that are shown there will help you kind of reframe and rethink about your work kind of in a maybe slightly different way than you would have otherwise. And so you will receive this and a copy of the slides from Lisa. But I do want to just point out like that this worksheet is something that we have utilized in our own work and thinking about how we layer in all of these pieces together, because when we're thinking about community development and community health, I really see them as intertwined into the work that we're doing. And so I just want to have a switch back over to the PowerPoint real quick, give you a couple key takeaways before jumping into questions. But as I said, community development is community health. The social determinants of health is everything that we do in community development. And so really making sure that you're thinking about those aspects when you're doing the work that you do. The second takeaway is that a social determinants of health lens really opens up your work to new opportunities and possibilities that maybe you didn't think about before, and how you can layer in these opportunities moving forward and expanding the work and expanding your partnerships beyond what, we all have limited capacity and resources. So really expanding upon what we're able to do. And then the last one, this is actually a really simple way to reframe your work. You don't need to do a health needs assessment. I do believe that it is a very, very helpful tool and something that we are expanding to other neighborhoods in the Cleveland area right now, working with them to conduct a health needs assessment in 3 neighborhoods in Cleveland. And so I do see it as a starting point, but utilizing a social determinants of health lens is not something that needs to be done in tandem. It's something that you can do right now, just by asking yourselves a few simple questions and just rethinking your work, and to be just more impactful and more effective overall. So that I'm going to wrap up the presentation, open it up for any questions. We're happy to talk a little bit longer. Thank you guys so much.
Thank you, Amber and Hope. And for everybody that participated, thank you, Tom. I'm gonna switch over. We had some questions come in. There's still probably time, so type them in if you have them now, but going back. So prior to all this, what was your mission before? And then how big of a shift was this?
Oh, that's a great question. So I cannot recall what our full mission was before because it was very lengthy, actually. But it was focused on 3, I think it was 3 main sections, but it was community revitalization, really very specific to community development and neighborhood development more specifically. It didn't speak too much on resident involvement. There was some, but not as much. But we really shifted to think about how we want to be doing our work in the community. And that's really empowering our residents to either lead their own work or, help support them in their goals and their vision for the neighborhood. And so that was kind of our shift with our mission, and keeping in mind that community health framework of it's not just us at Old Brooklyn CDC, but it's the residents who make up the neighborhood. And the second part of that question was how big of a shift was it? Oh, what do you think? How big of a shift do you think it's been since you've been part of the team?
Well, they brought me in and I'm the community health coordinator. And I feel like in the past, I've only been with the organization for about 2.5 years, but in the past, like Amber said, it was focused really solely on neighborhood development. And there's nothing wrong with that, but we could go deeper, which is what we decided to do. So now, like all of the programs that we talked about today, we shifted those a lot. So I would say it was a pretty big shift, but at the same time, it made sense to do it that way. So it wasn't. That's my answer.
Yeah. So I would agree. You know, it's not so much that it was a complete change in our work. It's more, you know, we're still doing the same things that we've always done, working with small businesses, working on housing in our community, you know, building houses, renovating houses, looking at redevelopment projects in the community. But we're also doing more specific work when we're looking at those projects. So how is this going to impact the community? What does this mean for you know, the small business community? Who is our audience when we're trying to create programming? One of the big programs that we have that we're creating for this year is actually a combination of two things that we did last year, where we're integrating small businesses within the event, but also making it really accessible to young families because we saw that as a need in our community. And it's hopping around to our different parks because we knew from our health needs assessment that only 40% of our residents utilized our parks, and we have some really nice ones. And so we were like, this is alarming to us, and like we want to know more. And so we found that most people just didn't know about them. And so now we're creating this programming that we can move this event from park to park, get more people familiar with the neighborhood, get out exploring, but also layer in these different opportunities. And that's one example of how, even though we haven't changed what we're still doing events, we're still doing community building, we're still working with small businesses. It's just the approach is a little different than it was before. Great question.
Yeah, thank you for the thorough answer on that, and remembering both parts of the question. I'm terrible at that. Real quick, that somebody had asked if you can share the Healthy People 2030 plan. And I think you and I had talked a little bit about maybe like your guys' plan if people wanted it. So if you can share that with me, and I'll make sure other people get it.
Yeah, so the Healthy People 2030 plan, that's actually put on by the Centers for Disease Control and Prevention. So if you just went to their website and typed in like Healthy People 2030, you'll be able to definitely find that. But as far as our community health needs assessment, we conducted that in 2018, and I'd be more than happy to send that over to Lisa and have her share that with you guys as well. And it goes into all of the data that we collected and in a report form of how we did our health needs assessment and then what the results were. In the last, I think it's the last page or two, has our 6 focus areas listed on it.
Thank you. And then here's a whole host of questions together. And like Kelly, I know you asked this. This is something that you can connect with me on if you want a little bit more, because I can put you in touch with somebody. But can you guys talk a little bit more about the home rehab for seniors and your volunteer groups? How did you, everything kind of in there. Everything. What were you doing? How'd you do it? All that.
Yeah, that's a great question. Well, that's a great slew of questions. I love it. So our home rehab program, I think, is a little bit more on the unique side for our community, at least. So we work with seniors and disabled folks who are living in Old Brooklyn. They connect with us, and we have 2 different programs that we are running. We have one that is only during the summer, and we have a group come in. I can't remember the name of it off the top of my head, but what was it?
World Changers.
World Changers. Yes. Thank you, Hope. World Changers, we partner with this group where they will do full home exterior like rehabbing. So painting, making just like small fixes on like handrails and porches and things like that. We don't do full rehabs as far as like the big projects. So like roofs, water systems, things like that. We just don't have the capacity to do that. But we do work with World Changers on the full home exterior during the summertime. And then our other project where we do like porch repairs, so like smaller exterior repairs. So painting projects, home repair, changing out fixtures and like things like that within that framework. And then we also do, we've been working through some home renovation programs as well. That is very new for us because we just haven't been in that space previously. So as far as the volunteer group side of that question, we don't have an official volunteer program at this moment. Our partners through World Changers are volunteers, but they are organized through World Changers, but we partner with them. But we are currently working on creating a volunteer program in our community to help us build capacity in this space, because we know that it's something that community members are interested in volunteering for, and it's something that we need help getting volunteers to do. So we've, through conversations with residents, they're looking for ways that they can get involved in the community. And so now it's just a matter of putting the two together and creating that volunteer opportunity. So as far as recruiting volunteers, it's something that we're working through. And if anyone has any best practices in that space, I would love to hear it. But it's something that we have an AmeriCorps Vista who's been working with us over the course of the last year to actually help us build out that volunteer program so that we're able to be more effective in our work. And we see the volunteers as not just helping on home rehabs, but actually being able to be integrated into our work so that we can hear what they would like to volunteer for as well, instead of just providing programs for them too.
Thank you. And then, yeah, we have time. If you have other questions, feel free to type them in, or I'm going to ask this one and then we'll see how we're doing in case someone can unmute with our last 10 minutes. But what are your plans for tackling food access year round?
That is a great question. It's something that we've been working on. As I'm sure most of you guys know, it's very difficult to find investment in development properties. And so we have worked with a number of partners to identify potential locations, but the investment in like a grocery store in our community has been very difficult. We would love to be able to do that and provide that space. We don't have a full service grocery store. We have some smaller stores that some people do utilize, but for the most part, people have to leave the neighborhood in order to meet their daily needs as far as grocery stores and things like that. And so the farmers market was that kind of step one of reimagining how we utilize that space. We've thrown out a few different ideas of doing year-round farmers markets, which has also been a challenge for us just based on the vendors and having products available. And so right now we're in some conversations. We had a Rite Aid that recently closed within Old Brooklyn that we're looking at as maybe that's a potential opportunity for a smaller grocery that is a full service space that, located in the heart of our neighborhood, has enough parking, which is always something that comes up, is on a major bus line. And so there are some opportunities there and we've been exploring it, but it's definitely been a challenge if we're thinking about redevelopment of spaces and how they can be used. Great question.
Thanks. I want to give space. I didn't see any other questions come in since when I just asked if anyone wanted to unmute because they're like, yes, I have a question. I don't want to type it. Thanks, Tom, for sharing a link for a mobile market next month. So I guess I will add in our last few minutes, if there is, when you look back and like we were starting, right? If there was one thing you wish you'd known or you'd done differently, and like maybe as you look to do another assessment, you know, what would you do that might be different? What have you learned?
Yeah, so our health needs assessment, I think we learned a lot from that initial kind of practice on how we engage community, and how we kind of do how do you do community health? And so I think from that perspective of just understanding that this has been a process for us over the last few years. You know, we started in 2016 just trying to understand what is community health and what does that mean for our community. And so I think just looking back and kind of moving into this new space of expanding our health needs assessment work into other neighborhoods is now we understand like what that means. Whereas before we were kind of like figuring it out as we went. And so I think that's probably the best thing, like the one thing that we've learned throughout this journey, is just how we can utilize the social determinants of health lens, what this actually means in our work, and how the health needs assessment has guided us, and how we've connected it into our strategic planning. So when we did our strategic refresh, we elevated community health to be integrated into all of our work rather than just a standalone aspect, because we really, as we explored more and kind of got into the weeds, we realized that community health is everything that we're doing, and kind of just learning as we went through this process was really helpful, and has given us the ability to be able to share pieces of that process. And I think the social determinants of health lens was something that we didn't realize at the beginning was so important. And now it's part of the work that we do every day. It's in conversations and how we do our planning and how we're connecting with residents and the types of programs and stuff that we are creating. Because it's based on, you know, what the residents have told us they need and want through the health needs assessment, and then through continual engagement since then.
Thank you. And then Hope, I don't know if you have anything you wanted to add, or Amber as a final, like, whatever.
Yeah, I feel like the main takeaway is, like Amber said, you don't have to do a complete community health needs assessment to reframe your work. Like, you can do it just by filling out that worksheet, and just by brainstorming about it. It doesn't have to be like a years-long process to get to the point where you can reframe it to be through that lens. So I think that's the main thing that I would like you all to take away from this.
Yeah, I agree. The social determinants of health lens is a tool. It's something that you can utilize in any aspect of your work, and it can be used across borders, and across categories. It's something that you can think about food, but you can also think about housing, and you can think about parks. Like, it doesn't matter what it is, because they're all connected, and really improving the quality of life for the people that you're representing, the people that you live with. And so I think that's the key part of our work.
Yeah, and if any of you have any questions or you want to discuss it further, like, we're always available. So our contact information is on the last slide in the PowerPoint. So feel free to reach out.
Thank you. Yeah, so I think with that, we're gonna go ahead and kind of close out today. Thank you so much, Amber. Thank you so much, Hope. for sharing the work that Old Brooklyn CDC has been doing, leading this session. Thank you for all of you for participating. Again, I'll be sending the recording, other resources, the worksheet, and some info about other upcoming Ohio CDC Association events and opportunities sometime in the next 4 working days. But in the meantime, please don't hesitate to reach out if Ohio CDC Association can help you in any way. Thank you again, everybody. Hope you have a great rest of your day.
Thanks so much, Lisa.
Thank you.